Good evening, and a very warm welcome to those attending the Families, Health and Wellbeing Select Committee. To our viewers watching live on the Councillors YouTube channel, it's live on Hillingdon, London. My name is Councillor Philip Corthorne, and I'm the chairman of this meeting. Details of the business to be considered today are shown on the agenda, copies of which are accessible online under the live broadcast. For those present in the room and intending to speak, please note that you will be filmed, and any statements you make will be recorded and made public. A reminder to anyone speaking today that your voice will only be audible online if the microphone is switched on. We are not expecting a fire drill, so if the alarm goes off, please follow officers to the fire exits and out of the building to the designated meeting points. For those in the room, please switch off any mobile devices before the meeting starts or put them on silent. Please note that councillors on the committee may use their laptops or tablets during the meeting to view the agenda paperwork. Before we move on to the agenda, I'd like to introduce the councillors and officers present. Apart from myself, we have Councillor Hina Makwana, Vice Chairman, Councillor Judith Cooper, Conservative, Councillor Becky Hagar, Conservative, Councillor Kerry Prince, Labour Opposition Lead, Councillor Jan Sweeting, Labour Group, and Mr Tony Little, Roman Catholic Representative. In terms of officers present, we have Kelly O'Neill, the Interim Director of Public Health, Alex Coman, Director of Safeguarding Partnerships and Quality Assurance, Carol Lewis, SEND Advisory Service Manager, Graham Puckering, Head of Mental Health and Elderly Services, and of course Anisha Teji, Democratic Services Officer, ensuring the smooth flow of business this evening. And proceeding now to the agenda itself, apologies for absence.
Apologies from Councillor Rodriguez.
Thank you. And declarations of interest in matters coming before this meeting? None declared. Thank you. Point number 3, to receive and agree the minutes of the last meeting. I move minutes for the meeting held on the 31st of March. Are they agreed?
Yes, it is.
Okay, thank you very much. And agenda item 4, to confirm that the items of business marked part 1 will be considered in public, and those marked part 2 will be considered in private. And with that, we will move on to agenda item 5 and proceed with the meeting. So, if I can just say a little bit for context, we've got, this is a Public Health Integrated Service contract report, which I've been eagerly waiting for a long, long time, actually. It's great to have Kelly here to present this to us. I'll say no more for now. I'll say over to you, and I'm sure we'll have questions, so please go ahead, Kelly.
Thank you, Councillor. So I'm going to just do some headlines from the report, just to sort of provide some details of where we are in terms of performance. And the report really focuses on the 4 main contracts for public health, the ones that we spent most of the money on. And I've also included a section on NHS health checks, which isn't up for any procurement or activity in terms of the way that we commission that programme, but there are certainly some improvements that need to be made to make that particular programme more effective. So these are contracts that are externally funded and externally provided by different organisations outside of the council. What I've set out in the report is the levels of public health funding, and so you can clearly see that these contracts form the majority of the £18.5 million public health grant spend. They contribute to about £12 million in total. This is £18 million is the annual amount of money that the borrower receives for prevention and early intervention activity, and the mandated elements of public health services that were transferred over to the borrower in 2013. As part of this sort of public health grant spending, there are conditions which have to be assured that we are meeting the requirements of that investment, and as part of an annual process I have to provide assurance that the outcomes that we're invested in meet those conditions, and actually we can start to demonstrate the impact that those services provide for residents in the borough. I would say for that latter point, it's very much work in progress because some of these areas are quite difficult to demonstrate in terms of real outcomes, more that they're commissioned to provide outputs of activity. So, as I say, that's part of our improvement plan for this year. So all of our public health measures are fundamentally under two big labels, which is increasing the healthy life expectancy of residents and tackling health inequalities in our borough. Table 1 presents very headline figures on where £18.5 million of public health spend is attributed. And as I said, most of the particular paper is focused on the £11.9 million of externally funded contracts. In terms of procurement plans, so these are contracts that have been extended put to the full extent of their contract length. And during the last 2 years, we haven't been able to commission new services because of the pandemic and the inability to sort of start procurement processes. So we're currently working on the procurement plans for those 3 contracts that are in Section 4. They are the biggest contracts in total, so they will be extended for a short period of time to really understand what the service model needs to look like moving forward, because there's a significant amount of learning that we've had in the last 2 years that we really need to focus on about tackling the inequalities within the borough. So I think that's a good thing. And it allows us some significant lead-in period, because these are contracts that require quite a significant amount of infrastructure in terms of assets, and for one of them, clinical services provision. So the first one is integrated sexual health service contract. That's provided by London North West. It's a contract of £3.5 million. This is a good quality service. It provides pretty much all of the outcomes and outputs that we've commissioned from that service. And they do that through a main provider contract, which is London North West, and a series of subcontracts to provide very specialist elements. Now, the service is delivered over 3 different sites. For a borough this size, that is probably more than I would expect, but the way that the borough is elongated in terms of length, that would provide a suitable level of access. So whereas you would expect normally probably 1, possibly 2 for the population size, in terms of ease of access for this borough, 3 is the right level. The services it provides services to anybody who lives in the borough. It also provides services to people out of the borough. So we get a lot of activity that goes elsewhere, because often people don't want to access sexual health services close to where they live. There's still a stigma associated with that. In terms of need in the borough, it's pretty comparable to most of the other London boroughs, particularly the outer northwest boroughs. I don't see any real difference. And the service really focuses on some really vulnerable groups, so there's really targeted effort in terms of young people, adults at risk of sexually transmitted infections and HIV, women attending for pregnancy terminations and repeat attendances for abortions, users of sexual health services who repeatedly experience sexually transmitted infections, but also hardly reached communities, and these tend to be people with mental health and learning disabilities, and sex workers and people who suffer, who experience domestic violence, trafficking and sexual assault, and then male service users. So predominantly the service does see women, but it also sees men who have sex with men, and that particular service as well is well resourced. In terms of the activity data really is very much skewed because of the last 2 years. Much of the services for sexual health have gone online quite a long time ago, and actually this service has been an online service for quite a series of years, and actually people have become very used to using that service, so we haven't seen any difference in performance. In fact, we have probably seen a slight increase as face-to-face contacts were over the last 2 years were reduced because of that close contact requirements. So I think the service provides a well catered for resource. Now, in terms of it, as I said, it's a good service, provides good quality clinical oversight, but there are always areas for improvement. So the Hillingdon is an outlier for repeat abortions, or abortions and repeat abortions for women over the age of 25. So looking into long-acting reversible contraception, particularly provided through general practice at an increasing level, is a good thing. Targeting people with learning disabilities for sexual health services, and as I said, supporting sex workers in the borough to properly have fuller sexual health services. The second contract is a substance misuse service. Again, a good service comparable with other areas. I would say it's comparable, no more. Now that service is being driven at the moment by the new Harm to Hope strategy, which has been published by the government but authored by Dame Carol Black, who's been spearheading to deliver against three priorities: a world-class treatment and recovery system, achieving a generational shift in the demand for recreational drugs, and breaking the supply chains, which is often referred to as county lines. Now, it is fair to say that over the last few years, drug and alcohol services have taken much more of a back seat than they have done historically. This is an ideal opportunity to put them at the fore. Now, the thing about drug and alcohol services, they tend to be high cost for the number of people that access them, but these individuals lead very complex life, and the actual return on investment providing good service to these people who, as I say, who often live very chaotic lives is very high in terms of that return. So when we look at the sort of performance of this service, often the figures, which are presented as Table 4, often look slightly low. But actually, those figures are pretty good, because most of the time it takes about an average of 11, I think at least 11 treatment cycles for people to actually successfully complete their treatment, and often they will be an ad hoc in and out of service. So often what the service does is it maintains people safely in service and supports them through a very, very long duration. It can take up to between 5 and 10 years for someone to fully leave a service. In terms of improvements, as I said, it's the implementation of the new strategy of Dame Carol Black, and there are lots of sort of additional support, particularly around drug and alcohol awareness amongst young people, particularly secondary school children, and a sort of a review of addictions to opioids, particularly sort of referral pathways from general practice, which has sort of emerged in the last few months as something that we need to target. The biggest contract we have, which is the next one, is the 0 to 19 Healthy Child Programme contract. For reasons, for long-standing reasons, this has been led by the Resident Services and Social Care team. We started as a public health team to move back into this space and support that particular contract. This is a service that's divided into two. 0 to 5 is the health visiting service in early years, and then there's the 5 to 19, which is a service, a nurse service for school-aged children. There has been a long-standing transformation program associated with this particular service, and in terms of performance, it's mixed. There are areas of good performance, and which is comparable with other areas, and other areas that need quite considerable improvement. That's well known and that's understood, and that transformation program is ongoing and started to reap some benefits. Some of the data in terms of performance is presented at the bottom of page 18. On page 19, there was, over the last few months, a concern about the number of people who did not attend, number of families who did not bring their children into service. So the service provider has started to look at the number of what we refer to as DNAs. And because this is a universal service, it's really important that children are seen periodically. One, to make sure that they are being well looked after, and two, to ensure that they meet their developmental milestones. And if they don't, early intervention is taken to tackle that. What we have seen from the data, and the data is over a relatively short period of time, is a significant increase in DNAs during in November. That needs to be looked into. I think it is probably due to two reasons. One is people probably didn't attend because that coincided with the wave of Omicron, and I would also say that possibly the health visiting service was also supporting wider NHS services at that time. So we're yet to see some sort of more recent data to see whether that pattern whether that November incidence has developed into a pattern. On the second table down, what you'll see is over a 3-year time, the various milestones of children, their 12-month check, which is a mandated element, and also their 2.5-year check. Now this is, and whether they attended, this is a common feature to see that children tend to DNA at a greater level at their 2.5-year check because parents tend to go back to work. And so you tend to see that in vaccination programs as well. Now, that doesn't mean to say it's okay. It just means to say that we probably need to look into the access to the service, because what we do know is that this service is a 9 to 5, Monday to Friday, and when parents go back to work, accessibility is a little bit more problematic, as many of us mothers fully are aware. So service improvements also need to look at that, and that will form part of the transformation plan. In terms of improvements, one of the areas that the targets clearly haven't been met is National Child Obesity Programme. The measurement programme that's part of that is definitely one of the mandated elements of public health where the uptake was pretty low. And actually we know that child obesity in the borough, similar to other London boroughs and similar to most other places in the country, is going up rather than plateauing and coming down. So what we've done is we are going to invest into a whole systems approach to obesity. 5 London boroughs have funding. We're going to work with Hounslow because Hounslow has funding from London councils. So we're going to piggyback onto Hounslow and do it together. And this is a series of engagement work with communities, particularly more deprived communities and communities where there's the highest level of obesity, and talk to our residents and families about what are the pushes and pulls for obesity and what they think would make the difference. Because the danger is we keep moving forward doing the same things over and over again, the kind of the Einstein theory of madness, and expecting a different outcome. And the other area where we're really going to focus on, which is associated with that whole system level of obesity, is oral health and poor dental health, which we know drives a significant amount of planned activity and unplanned activity in primary and hospital care. And actually, this is an area, this is completely avoidable, and we can tackle this. We just need to invest into it and really target some effort there. Finally, penultimately, NHS Health Checks programme. I won't go into this one particularly too deeply, other than to say that the performance is pretty average. We can do considerably better. The so what factor of what happens after a health check needs to be properly sorted out. Health checks tend to be done, but what happens after somebody's highlighted at risk seems to be a little bit, that's the uncomfortable truth on that one. But actually there is considerable opportunities to embed this within the HHCP in order to be used as an intervention in support of the long-term conditions and the rising risk work to reduce the number of people who have chronic long-term conditions. That hasn't been embedded properly. It's an opportunity to do better. And then stop smoking services is the final area. Now, stop smoking services, certainly when I started in public health, was one of those top measures. That and MRSA, bacteremias, was the one thing that everybody wanted to focus on in terms of a target. But gradually it sort of dwindled its way down into a lesser target, if ever a target at all. And I think this is something that we need to put back onto the radar, because actually the people that are still smokers, given that the the prevalence of smoking is dramatically reduced, are those people that would most benefit from stopping smoking. These are the more deprived communities. These are some women who are addicted to smoking and continue to smoke throughout pregnancy, mostly not out of choice, but through addiction. And these are people with mental illness and severe mental illness. And in the paper it presents the prevalence of smoking in the borough as 10.1%, but when you start looking at people with mental illness and severe mental illness, you're looking at over 30% of people. This is, as I say, they're targeted work. There are no low-hanging fruit here, and we need to do considerably more and invest more into this. So as we move forward, we've obviously got the procurement plans to do, but I think part of the work that we're starting to do with business intelligence is to think about not just doing incremental changes in profiling the public health spend, but using the opportunities of a new JSNA and a new health and wellbeing strategy to really rethink what the needs are and how we align the prevention and early intervention spend that comes from the public health grant into areas that make a difference, rather than try and do everything, but really think about what the root causes of ill health are in the borough and do something specific for that at the right level that funding will deliver some good outcomes. Sorry, Chair, it's a little bit more than 5 minutes. I have, Chair.
Kelly, can I, before we open up for questions, can I just say thank you very much for that introduction. That was, I think it's a very good report, actually, and I must admit, as a committee, we've had things to say about some of the reports we've had in the last few months, so I think it's a very good one. And it takes me back to Cabinet days when we were talking about the opportunities coming forward within public health with these contracts. But I'll keep quiet for now, because I'm sure my colleagues have got questions they want to ask, so I'll look around the room. Councillor McCartney is indicating, and okay, so bear with me. I can do one thing at a time. So Councillor McCartney, Councillor Prince, and thank you very much indeed. So Councillor McCartney.
Thank you, Chairman. Thank you, Kelly. Really good report, and I really liked your presentation as well, so thank you for explaining everything really clearly. I wanted to just focus on the substance misuse services and the support groups that are offered. Do we have an idea of what the attendance has been like at these support groups, and perhaps how effective or successful these groups are?
We don't have numbers in terms of, and I would imagine, and I'm guessing this on sort of past experience, that the attendance may be quite variable, and actually the commitment of people to turn up on a regular basis, it depends on the individuals and the other challenges that are going on in the individual's life. And that's not to say that people with drug and alcohol addictions all have other challenges in their life, because some people have long-standing, particularly drug issues, drug addictions for a long period of time, and successfully are employed and continue with their lives. So, but as I said, it's pretty ad hoc in terms of the sort of attendance and the support that's provided, because people tend to drop in when they need to, rather than continually attend as per, ideally on a regular basis. So I'm happy to provide that data if I have it.
Councillor Prince.
Thank you, Chair. I've got several questions on the same issue, if that's okay. Firstly, just want to thank you for a really inclusive report, lots of using inclusive language, which isn't always received, so that's really, really good to have. So my 3 questions revolve around the integrated sexual health service. So firstly, it says 68.2% of sexual health kits returned. Only 68.2% of sexual kits are returned. Why is that? Do we know why there's such a gap, and what are we doing to improve that? Secondly, why does the service specifically go between 13 and 90? I was just interested why it stops at 90. If there's evidence there, or if it's just a catchy way of saying it. Just interested in the justification. And then the third one is there any explanation on why we're an outlier on abortion rates? And that's the 3. Yes, repeat abortion rates, sorry.
Yeah. Yes, fine, yeah. The answer to the third one is I don't know. And it surprises me, given the demography of the borough, and actually really does warrant some further review. And I kind of was looking at the sort of public health indicators for that before I came, just to see if there was anything that I could see that would indicate, what was it about? What is it about the data that you could see that's underlying it? And without a sort of a deep dive into different areas or understanding sort of some of the characteristics of those women who attend, can't really make any specific judgments, but it is an area that I will look into, because as I was doing the report, that's when it emerged. That was like, oh, that's rather surprising. So, as I say, does need to have a bit of a look into as to try and explain that. Gap in kits returned. Actually, I was quite surprised that quite that many were returned, because and if you look at some of the other sort of programs that get sent to people's houses, for example, the bowel cancer screening program, the level of return is considerably lower. So I would say that is not a bad return rate in general. It could be better, but I think that, you know, generally people tend to order something and then it's not that they don't take it, it's just it doesn't end up in the post, really. I can't really answer that any further. And in terms of 13 to 90, that is a really good point, because that would suggest that people over the age of 90 don't have sex, or don't have safe sex, and safe sex in different ways. And actually, you know, that's part of society that we need to recognise that there are people that do. So that's a good point, well made, and I will have a look at that. And I will find out whether people are attending over the age of 90, because actually that would be a really good news story for sexual health.
Interesting point. I'm too old to blush, but there we go. Shall we, Councillor Haggard next, please?
Yes, thank you. A really good report. I love the fact that when you're looking about what we can implement, what we can change, how we can bring it all together, and the improvements that you've already highlighted on here. I think that's really sound. So I just want to make that quite fast. What I was interested in, as well as the prediction rates, and I know that's quite difficult to do, but in each one of the categories, where we were before, where we are now, and where we are looking to in the future. Especially maybe around the impact of COVID and the drugs and alcohol. I caught a bit that you actually did say, but I didn't quite catch all of it. You said there's been quite an increase in the last few months, or something's been merging in. So a little bit more about that would be good. And how we are looking at this in the future, because I presume that obviously more people, the drugs and alcohol, would have gone up over COVID, and what we're doing. And and the other one was about, I was really pleased you picked up about the health checks, because that was something that was definitely I've been looking at, and since the GPs again have been shut for a good year or so, I know that the cancer research has said that actually there are really low numbers, which isn't matching as to where they should be. So people obviously aren't diagnosing themselves, and we do know, don't we, that especially males don't access the GP at the best of times, so if they're going to be shut. So again, what are we working around those? Thank you, Chair.
Yes.
Okay.
So let me answer that. So in terms of increased activity, some of that is predicted, some of it is actual and started to be seen. So what we do in public health is look at trends and patterns, and some of it is relatively accurate, something finger in the air. So actually, by looking at a pattern, you can see what the baseline need is for a particular area, and then you look at the demographics and you think, actually, does that look? So when we talked about sort of abortions, you know, for a population of Hillingdon, that just seems wrong. Okay, so actually what you then start to look at is benchmarking that information against what we call statistical neighbours. Now, most of the time what we tend to do is benchmark ourselves against London, as if other London boroughs are statistical neighbours. The truth is, that's not true. And if you work outside of London, your statistical neighbours, so I used to work in Luton, statistical neighbours were Slough and Leicester and various other places. It was never Hertfordshire and Cambridgeshire or the rest of the east of England. So actually, I think what we need to do as part of that is start to think about who are our current statistical neighbours, and what is their data showing that may show some comparability to us. And actually, have they picked it up? What are they doing about it? What is it about their characteristic that they may have highlighted? And then start to think about working together. The one great thing about working in a public sector organisation is that you can steal with pride and get away with it. So in terms of that trend, we know that people were drinking more. You know, there's lots of evidence to say over lockdowns, people did it in lieu of, it was something to do, it was easily accessible, and many people weren't going to work on a regular basis, so it just happened. So if you project that pattern forward of what we're currently seeing, and also people starting to get back into work, dealing with some degree of dependency that perhaps wasn't there before, we can start predicting that we need to recognise that demand may start increasing, and actually facilitate how do we get the service to be able to accept and increase in the number of referrals. And if we keep monitoring it, then we'll be able to see, well, actually, how far has demand increased? Is that trajectory that's still going up? And how do we create more capacity if it looks like it's not peaked? So some of it's about predicting, but actually some of it's about just making sure that there are resources available, so those people who come forward are never turned away, because if they're turned away, they rarely come back. And that's what essentially what we do with pretty much sort of most of the work that we commission. But I have to say that sometimes, as I said, we do this kind of year-on-year tweaking around the margins called incremental budgeting, rather than thinking to ourselves, well, actually, how different is our population from what it was 5 years ago? Do we need to really think about reprofiling? How do we spend that money? And again, thinking about what's different now. And so actually we're starting to think about how do we do that, but it's a big exercise. And in terms of health checks and cancer screening and TB and hepatitis C, hepatitis B, sexually transmitted infections, immunisations, that's the whole arena of health protection. And I think Dan Kennedy mentioned at the last meeting, one of the things that we're really invigorating is the Health Protection Board. Now, the Health Protection Board is, for obvious reasons, been really focused on COVID for the last 2 years. I have to put my hands up and say that I'm a specialist consultant in health protection. So we've actually got the Health Protection Board up and running, and this week it initiated its second meeting of having a really comprehensive work plan that tackles all of those areas that have been marginalised and sidelined as a result of our focus on COVID. Now, what I can assure you is that most of those indicators don't demonstrate significant concern, but there are areas that warrant some immediate attention. But we know where they are.
So I've got Councillor Sweeting next.
Thank you very much. And can I say your professional enthusiasm for your subject is actually infectious.
Thank you.
So I do thank you for the report. I'm going backwards really to when I was first a councillor, and I read from page to page the Joint Strategic Needs Assessment report and saw certain areas of concern and certain areas of deprivation. And just looking at the quite difficult to view graph on page 19.
Yeah.
And sort of trying to work out, yes, they are in alphabetical order. It would seem that some of the wards that were of concern way back in 2014 are still there.
Yes.
As areas of concern.
Yes.
And so really I'm asking, how do we know that we are improving in those wards? Because I'm still seeing, deprivation problems in various wards. I'm not going to be specific, but various wards. How do we know that what we are spending our money on and what we are doing is actually coming out the end of that, making our residents in those wards better?
So let me pick that up first. You can see overall in the borough that things are improving for some indicators. In some indicators and some public health indicators, it's pretty much plateaued, and that there does need to be a real refocus on areas where that plateau or that lack of improvement has been quite long-standing. One of the things that we have tended to have done in the past, particularly where there have been universal services, is to apply the concept of universality quite literally, is that everyone gets exactly the same. Okay, that doesn't work. So that's why we have what's called universal proportionalism, which essentially is a big word for saying, actually we give everybody the same, but actually we target and weight the work considerably more to areas that are most deprived. And that's how we tackle health inequalities. Now the difficulty is on that one is that that's quite a systematic change in the way that resources are attributed. So you've still got to provide the services to everybody else. It's a bit like saying you can't stop hospital services to focus on prevention. You've got to do them concurrently because people are still getting unwell. But actually what we're moving towards, and some of the sort of the new NHS England work, which is called Core 20+5, which is, and it's on our health protection work plan, so we've got that covered. It's really telling us to focus on the 20% most deprived areas in the borough. Now, you can cut up the borough in many ways, and you'll find 20% in at ward level. You'll find 20% at borough level, and the danger is that you don't want to miss anyone. So I think that there is, as part of our planning, particularly around this Core 20+5, is to try and slice and dice and look to see where those pockets of deprivation truly are. Because, as I say, if we looked at the borough as kind of sort of a full borough level, the areas that we see are deprived may not be the ones that truly are. We have to really deep dive into really lower super output areas and have a conversation in those different areas about what the true level of need is. Because even in those lower super output areas, there is such a significant difference in have and have-nots, even in small series of roads, that we really have to sort of tackle that. And through that kind of Core 20+5, and it's a principle, the NHS England drives to tackle 5 outcomes: serious mental illness, women who are from BAME backgrounds that experience really adverse outcomes when they're pregnant, and then people with respiratory disease who tend to be admitted to hospital, particularly around COPD, and I'm trying to remember the other ones, but they'll come to me in a minute. But actually, that's a principle for 5. We need to apply that pretty much everywhere. So weighting towards those most in need, and it kind of comes with the sort of the levelling up, but let's just call them health inequalities at the moment. We need to really target those resources, those resources to those most in need. But actually, some of the work that I spoke about that we've been doing through the Health Protection Board, particularly around population health management, is about tackling those really deep-seated, entrenched, long-standing generational problems. But again, what I will say, and I will really need to emphasise, is that public health is not just about providing services. It provides services and NHS healthcare and healthcare in general only attribute between about 10 to 30% of really improving health. It's about the infrastructure that people live in, the houses and their homes, their access to good employment, education opportunities, feeling safe in their communities, and their opportunity to enjoy the environment that they live in. So actually, the council and all the services that the council provide are fundamentally more important to improving people's health overall than actually the services that are provided for them in terms of NHS services.
Wow. Okay. Thank you very much for that. Councillor, beg your pardon. Sometime since you were a councillor, Mr. Little. Before my time, Ian. Carry
on. Thank you. This is not an area of expertise for me, so forgive the questions if they're not appropriate. I wanted to ask about the smoking, and particularly there's no mention of vaping in there. Do we have a programme that deters people from taking even that up, and particularly aimed at young people? And my second is a little quibble and a plea. Could somebody who isn't involved in the service read the report? I spent my time reading it with Google in front of me to work out the acronyms. Half of them were explained and half weren't. Thank you.
Apologies for that. Vaping is a contentious issue. So when vaping was introduced, it was considered a harm reduction intervention. Now, and certainly when Public Health England's position statement on it, and many Stop Smoking services, is that in terms of moving people away from the use of cigarettes and nicotine, moving them to vaping, because obviously sort of the nicotine is the pollutant, the toxin, and moving them on to vaping was considered a beneficial sort of, as I say, harm reduction measure. That's not a position that's entirely agreed by everybody. And actually what we have seen is some people have started vaping when they weren't smoking before. So in terms of opportunity, there are. I don't think the service actively encourages vaping. I think when people are demonstrating a step down, they may be being directed to that maybe a harm reduction measure, but I have to say that the position on it is, as I say, there are differences of opinion.
I mean, converting from smoking to vaping may be seen as an improvement. I'm not going to quibble with that. It was my concern was more about young people taking it up,
Yes.
rather than taking up or having anything to do with smoking cigarettes.
And we know
that
happens.
not being necessarily a good thing.
No, entirely. And actually, one of the things that we have been trying to do is put in some sort of school age service sort of training programs, part of PHAC programs. Start thinking about how do we deter people away from sort of any of that. But quite frankly, you're quite right that young people are now opting for vaping when they probably wouldn't even have taken up smoking in the first place. And that's not an issue just here, that's an issue nationally. And apologies about the acronyms, I'll just make sure the next time. But if you want to send me over a list of acronyms, I'm happy to give you a brief. It won't be brief though, I'm afraid. That's good.
Thank you. I'm going to jump in with a question. I'm loving the debate, and it's fascinating. I could fully devote the entire evening to this, with due respect to other reports and other authors. This is fascinating. I'm going to jump in here because when public health came across to local government back in 2013, I think the thinking was very much around it was a big opportunity for us, without a doubt. Obviously, we're going to have to do more with less, because that's what happens in local government, of course. But although I've worked with some excellent people in the NHS, I think we've often felt that perhaps we're a little bit hamstrung by NHS ways of working, and perhaps coming across the local government would give us a little bit more opportunity to innovate in a way that makes people more receptive, perhaps, to taking up services. And I suppose I'm just coming to Councillor Sweeting's point about wards where there's deprivation. Isn't it right that many of the people we're talking about, many of the people we need to reach out to, are people who lack the wherewithal, the inclination, perhaps the support, perhaps the IT prowess, whatever you want to call it. These are people who really, if you like, need to have services shaped in a way that works for them and gives us the best opportunity to really get them on the hook, as it were, to really add some value. I'm just wondering how our thinking is developing around that, and to what extent we have any kind of a plan at the moment as to what that might look like.
So the answer, I think the way that we've looked at those people that don't access services, that we've historically called them hard to reach, which kind of indicates it's their problem rather than ours. So actually, the term hardly reached is probably a better indicator of, as sort of driven by the fact that we need to do something better to actually reach those people, because, as I say, these are long-standing generations of people that don't trust health services or don't access them because they don't see any benefit from them. And I think it's fair to say that when some people have access service, their experience of their service has probably contributed to them to never wanting to come back again. Now, one of the things that the new health and wellbeing strategy does refer to is a rather lovely line, and which really has to turn into action, which says that we will increase access to services, we will improve people's experience of services, and we will improve the outcomes and the benefits that they get from services. Now, we absolutely have to turn that into action, because that shouldn't be just a mantra. It's got to be something that's really meaningful. Now, over the last year, as the COVID vaccination has been rolled out, what we have seen is, an absolute shining example of the disparities that aren't just to do with COVID vaccination. These are long-standing differences in people accessing services, and it's fair to say that the people that are mostly accessing our services, not yours probably, are those people that probably least benefit from them, and the people that aren't accessing the services are the ones that we should be targeting, because if we don't target those people in a meaningful way and spend the time and the energy to do something about them, these are the people that are going to die prematurely. These are the people we're going to let down, and these people will spend the majority of their life either being having sort of a poor standard of health and well-being, and will be left behind. Now, the concept of levelling up and being fair and equality is to make sure that we don't leave anybody behind, and we do our utmost to make sure that those people who most need services, those people who are most vulnerable to a specific health need, really have the time and energy and resources invested in them. And sometimes that can be a hell of a lot of investment. I mean, even if you look at some of the COVID vaccination work that we've done, when we were first rolling out COVID vaccination, there were queues around the block. And if you looked at the sort of the cost per vaccine, you were down to £1 really, essentially, outside of the cost of the vaccine and the consumables. Now we're looking at hundreds of pounds for any person coming forward now. But this is entrenched, this is long-standing. This is not just, as I say, COVID vaccination. This is all vaccinations. This is cancer screening. This is people not wanting to access their GP services over a long period of time. These are people who don't take their children to the dentist. This is historical. And if we don't do it now, when is going to be the right time? Because we have got things lined up. We've got a JSNA that tells us where the need are. We've got a new health and wellbeing strategy that gives us the principles through which we deliver some of the services in a different way. And we've certainly learned from the last 2 years that we need to start engaging with people on a one-to-one basis, at least on a group basis if we're going to add up and do things meaningful. Now, if we don't do it now, there's never going to be a right time, or never going to be a better time to do it. But it's going to take some effort.
Thank you, and thank you for articulating my question far better than I did, and for your answer. Thank you very much indeed. Councillor Speaking's got one further question. Yeah.
It's just, it's very refreshing what you've been saying about boring down into those areas, those people, those groups, those vulnerable groups that, for whatever reason, have seemed to have sort of slipped under the radar. And a rethink on that is very refreshing, and I thank you for articulating that so well. And I'm a great believer in our statistical neighbours being brought into reports as colleagues around this. So will we, in the next report, whoever is going to be sitting on this, whoever's here, can we be compared to our statistical neighbours?
Yes, I'd absolutely endorse that. And just in terms of some really good examples of some work that's going on in terms of looking really deep, sort of diving deep into those people that are most in need. Some of the work that's been driven by North West London CCG, working with local authorities at place, sort of at borough level, and at PCN, that kind of groups of GP levels. This population health management work, this really trying to deal with a proof of concept of understanding what the data tells us about need, and then going to talk to stakeholders and residents and communities about what that particular need is. It's really resource intensive work, but actually it's the only real way that we're going to get better outcomes. So it's well worth the investment of time, energy and resource into doing that.
Okay, right. Councillor Boothworth, one more question.
Thank you, Chairman, and thank you, Kelly. I was most impressed with your analysis, and probably my questions now are going to be totally superfluous, but I will just pick up a couple of positive things. I was really pleased to see the constructive working with Arch. I think Arch are a brilliant organisation. I've got a great deal of time and respect for them. I'm very pleased to see that there is still a focus on prevention and early intervention. That must be key in not just in health but in education and other services. And I'm absolutely delighted, and I'm sorry that Dan isn't here to hear it, but I am delighted that you're talking about more effectively building robust evaluation methods. My heart sings. I'm really, really pleased. Having said all that,
sorry.
If we look at the National Health Service Health Check Programme, Table 9, by any measure, the number of health checks actually received is dismal. And that's people who actually made it to a doctor to have the health check. So there's something rather wrong there. If we look at the targeted priority activity, table 10, and I'm sorry I can't give you page numbers, my agenda doesn't work like that, the pharmacy results are significantly better than all other settings. So is that because pharmacies are readily accessible to most people? Is it because COVID has changed our perceptions of how surgeries work and we are sick to death of waiting on the end of the telephone for them to do something, or to have to go online to do it? I don't know what it is, but I'm quite sure that with your energy and enthusiasm, you're going to turn this upside down, which is what it needs. We need to stop talking about a top-down model. We need to start with where people are, which is what you're talking about. You're talking about place, not just access, but place, and going to the people where they are, which in many cases may be on street corners from what I can see around me. So I was interested that the chlamydia screening is going to use pharmacies, and that looks like a step in the right direction. I just wonder, 7 pharmacists doesn't sound very many in the borough the size of Hillingdon, how it's going to be advertised and supported so that people can find out about it and self-refer without undue difficulty or embarrassment, because that must be a key issue.
Yes, definitely. I mean, it coincides rather well with the P&A, which is the pharmaceutical needs assessment, is currently in the sort of latter stages of development. That's looking at the services that our pharmacists currently provide and the offer and the potential for what they could be providing moving forward. That will give us a really good understanding of who is providing what, because obviously as businesses, they essentially can provide pretty much what they decide to provide. But actually it allows us to give a really good understanding of geographically where services can be reached by different parts of the community, and obviously to think about opportunities for investing more heavily into pharmacists and trying to move away some of the activity from general practices, particularly where that's avoidable. And pharmacies are, they can be a one-stop shop. They don't have to have appointments, and you can turn up and everybody knows their local pharmacist. And actually that doesn't feel like the case, or people's experience of general practice at the moment. So we do need to really think about what are the assets in communities that people are most likely to access, and put the services where people want to go to at the time that they want to get there. In terms of service setting, as I said, I really want to have a look at tobacco control and stop smoking services, because actually in terms of pharmacy we really need to build up. I think there's 13 pharmacists that are currently offering a service. Actually we could make that even better. And one of the things that we need to invest a little bit more time and energy into is it used to be a model that practice nurses and healthcare assistants in general practice used to do stop smoking services, and some practices did a really fine job at doing that, and some practices want to go back to providing that service, but we've chosen to commission away from that, and I haven't quite understood why, given that there are some areas of the borough, particularly areas where prevalence of smoking is higher, that really do want to provide that service. So we need to think about what motivates people, what motivates some of our healthcare professionals to want to do that, and really grasp onto that where there is a motivation. In terms of health checks, you're quite right. The health check services provides a comparable service. What I would say is that the uptake is on the low side, but it has been low because of it's predominantly provided through general practice. It does need to improve quite considerably. It does need to embed much more in terms of what it is, the kind of so what and what do we do as a result. And I do think that there are wider models of providing on a community basis through different services. In fact, in previous roles, it was provided predominantly through leisure centres and community groups run by the sports providers in the past, and that was a pretty successful model. So, yeah, there are different ways of doing things, and I think as I say, what we've learnt over the last 2 years is place-based, local, that kind of 15-minute neighbourhoods, so we're calling it, or we're calling carbon-neutral neighbourhoods, but having things accessible within 15 minutes of a walk is the way that we need to really reconfigure services and make them more accessible. But good pick up.
Indeed, and I think pharmacists are a huge source of untapped potential that can play a big part in this without a doubt. I'm looking around the room. I'm reluctant to bring this discussion to an end because I'm thoroughly enjoying it and very impressed by the standard of questions from all sides as well. It's been a very, very interesting discussion, but I think I'll draw this to a conclusion now, as I was indicating now. So, firstly, Kelly, I'd echo what's been said about your professional enthusiasm. It certainly radiates, and I can certainly feel it sitting from here. And I very much like the vision that you're articulating. For a long time, this has felt like an opportunity. It seems we're getting to the point gradually as we align contracts where we can start to commission in a way that starts to deliver on some of these things that you're talking about. It's so important that we do. Excited for the future, I think we should be. And whoever it falls to sit here next time round in the new council and hear more about it, I think it'll be a great pleasure. So we'll see what happens. For now, thank you very much indeed. Thank you to your colleagues.
You're very welcome. Good luck to May.
Thank you. And can we agree with the recommendation? Agreed. Thank you very much.
Lovely. Thank you.
Feel free to stay, but don't feel you have to. Thanks very much. Thanks for coming. Thank you, Kelly. Right. Okay. So the next item, Councillor Prince and I spoke briefly at the end of the last meeting. I thought, wouldn't it be a good idea if we have an update on the Ukraine situation with Homes for Ukraine? Of course, we had an update from the leader. That was a paper written by Dan Kennedy back on the 6th of April, but it's timely, I think, to hear a little bit more about that and how things have progressed in the meantime. So to present that to us now is Alex Copeland. So over to you, Alex.
Thank you, Chair. I mean, I'll start just to kind of illustrate a bit how the system works, what the current situation is in Hillingdon, what are some of the support that we have in place, and some of the things that we are focusing on developing at the moment, and then I'm going to be taking any questions you might have on this. So just to kind of make sure that everyone kind of it's on the same page. The way that the system of applying to be a sponsor for Ukrainian family works is members of the public are able to apply online through a national, national website. They are checked by the Home Office, including doing checks against the Police National Computer, the PNC checks, and then they are approved as sponsors. Now, that's the first stage of approval of someone who wants to offer the support to Ukrainian families. The second stage of those checks are then passed automatically to the relevant local authorities, and then local authorities have a duty to complete a number of checks. In Hillingdon, we have a 4-stage checks on all the people who are applying to be sponsors and to receive Ukrainian families, and those include some of our anti-fraud services. Conducting checks involves housing officers, actual physical visits to check the homes and to check the conditions of the homes. It includes DBS checks, including enhanced DBSs for those families who include children or vulnerable adults, and it also includes social care site visits and welfare checks on both the sponsor families and the arriving families. Just in terms of some of the numbers that we have, because I think probably that evolved a bit since the last time you have the check. So we have 97 families in residents of Hillingdon who have been approved through the national system to become sponsors for Ukrainian families. They have been matched with 97 Ukrainian families who are currently through the process of obtaining visas and travelling to the UK. To date, out of the 97 families, 8 have arrived. So that's where we were as of beginning of this week. We know that in total there are 222 people as part of 97 families who have been matched with sponsors in Hillingdon, and out of those, 51 of those 97 families also have children. So we're also expecting to see a total of 80 children arriving through the scheme. Excuse me. As part of the check that we've done for the 97 families, about 24 of them have been either changed their mind as part of the process, or they decided not to progress with their application to be sponsors, or they've been rejected after the on-site visits by some housing officers or social care. The main reasons for people being rejected are mainly to do with housing, and it's mainly to do with the landlord's agreement for the tenants to be receiving Ukrainian families, or is to do with the overcrowding of the homes if they were to receive families. And we've heard examples of people who, trying to do a good thing, they put themselves forward, but the conditions of the home and the number of people already in the home will not kind of allow to have a family from Ukraine with 5 children, for instance. So there are some examples like that. In terms of the Ukrainian families arriving, the support there is in place is available to them from the point of arrival through the airport or other means. And we did commission a charity organization called Scrutiny, who are with the agreement of the arriving family, are providing support in terms of registering with GPs, registering for benefits, registering with housing, schools, all those sort of other ongoing and floating support that is required. The referral mechanisms and the way in which we interact with the families with Trinity has been developed jointly with them, and they are in place, and they seem to be working well. Other things to say, probably this to say a couple of issues that we are still working on, and we're working with. One of them is about homeless presentations to the Council of Ukrainian families who arrive through different other visa arrangements. So simply put, are families who are fleeing Ukraine and they're just arriving at Heathrow and they don't have a connection, they don't have a family waiting for them, and they don't have a sponsor either. So in those cases, they apply for support to the council. They become homeless support, and we are supporting them either through housing or through children's services that have children, and also supporting them to get to a point where they're able to claim leave to remain and to claim benefits and apply for work. That is happening. To date, we have about 11 families who are assisted that way through either housing or children services. And Trinity, the charity I mentioned, also offers support in making sure they have the right applications for the right visa. And the other thing that we are not quite clear at the moment, we're still waiting on national guidance on that, it's about the rematching of the families whose sponsors are not accepted or are rejected, or indeed they change their mind. So there is a national system, there is a national database that kind of keeps track of all the sponsors and all the match families, and we as a local authority, we do have access direct to that database to update it regularly based on our checks and to say if the family has been progressed, agreed or not agreed. But there isn't a clear understanding what's going to happen to those families whose sponsors have been rejected. So that's a piece of guidance we're still waiting for at a national level. So I think with that, I will more than happy to take any questions you might have.
Okay, thank you, Chairman. Thank you, Alex. My question is around safeguarding, especially around children and young people.
Yeah.
You mentioned enhanced DBS checks and social care site visits. I'm interested to know how that's impacting the services that we provide, and also the children's services as well. What's the pressures that we're facing, perhaps?
Thank you, Councillor. The way in which we plan to support those families. So if I'm focusing on children's services, because obviously questions about children's services and safeguarding of children, and the way in which we plan the provision of the services, we looked at all those 97 families who are arriving. We looked at if they have children or not. So basically, at the moment, what we have is a pre-allocation system in place where each of those families they've already been allocated a social worker and a team manager who will be undertaking the visit when they arrive, and they will do a welfare check. And from that welfare check, there is a number of tasks that they will need to complete at the end of it to make sure that the right support is in place. So as soon as the family arrives, we already know who the social worker. They know who they are. And then as soon as the family arrives, they get notification automatically. So the family is here. They make contact. They do the visit within 48 hours, and then based on that, they complete the welfare check. Obviously, if there is any sort of safeguarding issues at any end of those two families at any point, then the normal safeguarding process will kick in. So as it stands at the moment, providing that we're not going to have tens of families arriving in one day, I think we're well organised. We're ready to receive and we're ready to provide our support. And the only other thing that I will say in terms of safeguarding, that having the ability to kind of see who's going to be arriving and the composition of those families, it's allowing us to have a planning in advance of what sort of services, what sort of children we're expecting. And we do have one situation when we know that we're expecting to see a 15-year-old who's unaccompanied, who will be arriving to live here with some distant relatives. So in that case, we already looked at those circumstances, and we know that will be classed as what we call private fostering arrangement, and we already started the arrangement, the assessment, and we already started the checking of the people. So by the time she arrives, everything is going to be in place, and we have the right arrangements for her to get to her relatives, and then we'll provide support as we would for any child who's privately fostered.
Thank you very much, Alex. Now, I've had indications from Councillor Sweeting and Mr Little and Councillor Haggar. So, Councillor Sweeting first, please.
It's just the practicalities on particularly the older children coming in. If they have their family that they're staying with and they need a school place in that area, we know that there's pressure on our secondary sector. Are schools being approached to be flexible and lenient with those youngsters that may well be needing to have a school very close to where the families are?
Yes, of course. And there is, I mean, school admissions, as you say, we know there are pressures there, we know the pressures are, but it's been made quite clear to all the partners, to be fair, not just schools, about the fact that we are supporting the refugees from Ukraine, and about the importance of having a multi-agency, if you like, a system-wide approach. And I didn't mention in my brief, but there is also, apart from having a cross-council project team, if you like, that meets at some point. We're meeting daily. Now we're kind of meeting twice a week to make sure that we have the right systems in place to address any raising issues like this one. We also have a multi-agency meeting that meets every week. At the moment, it doesn't involve necessarily schools, individual schools, but it does involve the Heathrow Airport, for instance, to make sure that we have the right receiving mechanisms in each terminal. Involves health, the health industry, to make sure that we're putting the GPs on standby if need be, or any other health services that might be needed. So I think in terms of getting the schools involved and everyone else, that is very clear out there about what our approach to supporting the Ukrainian refugees is.
Do you know our abutting authorities, if they're taking more than us or fewer than us? We are obviously, we've got Heathrow, and therefore, you know, you've told us about the 11 families coming that way, but how do we match up with our abutting authorities? I mean, considering the where the families are flying from, and considering that some of the air companies have provided, for instance, free tickets for families, you know, fleeing the war in Ukraine to arrive in the UK. Majority of the companies who are flying from safe countries like Poland or Romania or whatever, or flying straight from Ukraine, very few of them actually fly directly to Heathrow. So in terms of arrivals, local authorities who have smaller airports like Stansted or Luton are seeing significant numbers of arrival, much more than we are seeing in Hillingdon. And also, it's not just about how many people are arriving through Heathrow, it's how many people are arriving through Heathrow and then they stay in Hillingdon, because if they have family in the UK, they might be arriving in Heathrow, but then they go to their sponsor, they go to their family. So I think the important bit for us at the moment is the number of the 97 families who arrived. And last data that I have from other London boroughs, it was around. There's not great numbers yet. So we have sponsors, they identify, we all do the checks, but the actual arriving of families are not great numbers yet. So we're waiting for more to come.
Thank you. Next, Mr. Little, please.
My question's a variation on Councillor Sweeting's. Are we having the people who are interested in this scheme widely spread across the borough? And in terms of the schools, are we ensuring a spread of schools involved in taking the pupils?
I think that would probably be a question for school admissions in terms of how those families, those young people and children are going to be distributed. Because in terms of which families are applying to be sponsors, that's entirely a personal choice for each family. So we can't control the geography of the sponsors in the borough, and the catchment areas apply. However, if there is a prevalence in one area, I would expect that through school admissions and working with schools, we can work with them to be distributing within acceptable sort of geography the young people who need schooling.
Right, Councillor Hagar.
Yes, thank you, Alex. It's good to hear actually what we're doing, and it's good to hear what we're doing on the ground. So thank you for the report. I'm more interested really in the future. So how we're going to manage this, how many regular checks are we going to do, you know, in like 3 months' time, 4 months' time, 5 months' time, and also about how, or have we thought about how the communities or the people that are coming over, how culturally different it is, how we're going to manage whether they're going to all culturally come together. So where's the point that where they can all come together, say to meet and talk and discuss what they need and things like that. I'm very conscious, I think, culturally coming over into a completely different culture zone here of where we are, and that's going to be emotionally, mentally, physically, everything. So 2 questions there. Thanks, Alex.
Thank you. In terms of the check, as I described, there are a number of checks being done to make sure the families receiving the families are safe, and to make sure that the needs of those arriving are met, and there are services that are put in place to make sure those needs are met. Now, for all intents and purposes, once they arrive in Hillingdon and they settle here and they access benefits, they look for jobs, they have leave to remain for 3 years automatically through the scheme, then they become our Hillingdon residents. So anything in terms of support, in terms of checks, in terms of services, all that becomes part of the normal provision that we have for our residents. I would say that if, obviously, as part of the checks we identify, as I said before, any safeguarding concerns or things like that, that will be addressed to the safeguarding procedures and processes. If someone becomes homeless for whatever reason, that will be addressed through the housing and homelessness route. So we will be doing all of that like we would for any other resident. I suppose the only probably slightly different situation is for those families who don't have access to public funds yet, and they don't have a leave to remain, or they can't look for work, and then we'll try to help them and support them to get the right visa for them to kind of have those sort of that type of access. So for them, again, then it will become the normal services we have for our residents. And in terms of the cultural competency of our communities and cultural promotion of the new families arriving. As I said, we do have a cross council group of project team, if you like, who's focusing at the moment. To be fair, we were focusing quite a lot on how do we get ready for the new arrivals, how do we have the right support in place, how do we make sure that the sponsors are safe, and how do we make sure we have the right provision in place for people arriving with various needs. And people arriving, if we think about it from a war zone, many of them might have lost members of the family, might have lost their house and their livelihoods, and possibly some of them already still have people fighting over there, and they're not quite sure what happens to them. So what we were focusing on is how do we address that immediate need in a safe way. And going forward through our community engagement, who are already on board in terms of providing links with Trinity and other activities, I'm sure we're going to be developing various community inclusive programs to support, and also to support communities who want to come together to welcome and to provide that support.
Thanks, Alex. Councillor Prince.
Thank you, and thank you, Alex, for coming and talking to us about this, and I didn't have to, so that's appreciated. You said 8 families that have been matched have arrived, and it was 97 that were matched. What is the big reason for this discrepancy in numbers of people arriving?
Quite a few of the people who have been matched, they are at different stages of applying for visas and making travel arrangements in I think many of them are no longer in Ukraine. I think they are in safe countries, but they are kind of making their way and applying for visas and moving towards UK. So because obviously there is quite an influx of numbers, it's not very easy to say when every single visa is going to be granted, when the flight is going to be available, and when the people will actually be arriving. And that's why, in a sense, that's why we did a pre-allocation system, so that we are ready whenever that happens, because we are getting an upload from the national system on a daily basis. So every day we're checking any new arrivals, any new sponsors, and we are ready to react to that within 24 or 48 hours.
Thank you. A couple of questions from me, really. I suppose one is what kind of impact is this happening on us organisationally? I mean, clearly there's officer resource at the front line, services across the council, the benefits team, social care, children's services, not to mention partners. I just wonder what your assessment of the impact of that is, and what kind of support we're getting to make good those challenges that we have, shall we say. As part of our regular and very regular meetings that we have to kind of look at the situation, the evolving situation, there was a significant amount of effort invested at the beginning of this to make sure we have the right process in place, we have the right people in place, and we have the right mechanisms to activate those resources. And I think for instance, if we're talking about the housing checks, which are done prior to anyone to any of the Ukrainian families arriving, there've been a number of checks being done. I think about 30 of the people who've been 39, actually almost 40 families have been through the full checks. They've been approved, and others are at various stages of checks. So during about 3 weeks, a lot of colleagues from housing, they focus almost exclusively into making sure that those checks are done. So the impact was significant for a few weeks when everyone was kind of trying to get everything in order. So we're hoping to move slowly towards a business as usual almost system where we have the right people in place to do the right things. And also there is funding grants available from the central government that we're using to make sure that the right support is in place. And I'll give myself a quick supplementary, because I did have a second question, and that was around how easy is it for individuals who want to offer accommodation or support, financial support in any way. How easy is it for them to do that? Where is the information? I know that if you want to offer accommodation, it needs to go to central government online, and then you get notified. I, for example, have accommodation. Which seems an odd way of doing it, but I guess that's the process. I do understand that. But how easy is it generally for people to come forward and offer support in various guises for this situation?
In terms of accommodation, as I said, the process is now pretty well established. There's quite a lot of guidance around it, so we know how that works, and anyone who wants to do that will be benefiting from some support from the local authority as well in providing the accommodation. In terms of any other support, in terms of people who want to kind of to offer the support, there are a number of approaches to the council and to other charities. So people who want to donate things, or people who want to have various other involvement with the new arrivals, and that is managed through the normal channels about people being directed towards Trinity, for instance, and towards community safety or any other community engagement groups that we have.
No further indication. So with that, Alex, I'll wrap up this discussion. Thank you very much for your input. I think what this situation does show are two things for me, really. First of all, the generosity of spirit of so many of our residents who really do want to help. Maybe aren't always the best place to do that, but the will is there, and it's doing our best to help them. So it's good to see that's happening. And once again, our officer team is stepping up to the plate to meet a challenge which has stemmed from beyond our borders in this borough magnificently. So thank you very much to you and your colleagues. Please take back our thanks.
Thank you, I will.
And thank you for all your work on that. Thank you very much indeed. Okay, there's no report or recommendation, so we'll move on at that point, if that's okay. Thank you, Alex. Report, aren't you? I think you may be chipping in on the next one too.
The next one and the next one.
Okay, thank you very much. Right, so moving on then to agenda item 7, which is the making the council more autism friendly 1 year on. takes me back to my very first POP meeting that I chaired way back in January of 2021. And I came in at the 11th hour. We were framing recommendations to go to Cabinet, and what we've got now are those very recommendations a year on, and this is really an update on where we've gone to with that. So we've got Graham and Carol to introduce this for us, and I think possibly with some input from Alex as well. So please, over to you.
Thank you. As you said, this is a kind of 1 year on feedback from those 8 recommendations that were set following the making the council more autism friendly report of last year, which I think was completed around April of last year with the recommendations. I think I probably just want to start by saying that some of those recommendations have been followed and we've picked up on the key issues, but there are some things we've not been able to achieve for various reasons. And there are also lots of things that we've expanded on or taken down sort of perhaps a broader or wider route in relation to trying to achieve some of those wider goals and recommendations that were listed in the report beforehand. So I think I just want to probably start by saying that this is the feedback really is across the council as opposed to the specific areas that myself or Carol work across. We've obviously inputted and been part of all of that, but it is about trying to make this across a council-wide issue and a council-wide agenda. So we've done that through groups of meetings with a range of people from different parts of the council in trying to get some of these recommendations implemented and developed and move forward. So that's kind of the premise of where we've been. I can just kind of whiz through really, I guess, some of the recommendations and some of our immediate actions, and then perhaps Carol and Alex can contribute anything extra, and then we can come to questions. I think that might be the easiest way of doing that. So some of the sort of key recommendations. The first one was in relation to developing a checklist, and what was established, I think, was that actually the checklists that do take place across the council in various settings, in areas that we had understanding of, like in education, but in other areas as well, and also take place through some of the training that's offered. What was fairly clear was that those that nearly all of them are based very much around the NICE guidelines, and I think in the report there was a good example of a NICE guidelines checklist that could be used and could be adopted, and very much of the ones that are being used are very much based on those broad NICE guidelines in relation to checklist development. So there are some areas that have worked with checklists quite effectively in the last year and prior to that, and then there's those that we're looking at where we can develop. One of the things we're trying to achieve currently is to bring those together in 2 or 3 different ways. So one would be to have a consistent and equal checklist that we can use across the council, but within that as well also develop, which is part of the things we're piloting at the moment, an additional part of that checklist which would then give us an opportunity to effectively action plan within those areas to make sure that any activity that is picked up as a need to be completed can actually be completed. So that's some things that we're looking at. Also, there is a lot of checklist activity going on across the council, partly through the training that I mentioned. That's not captured actually at the moment. They're done on an individual basis, so it's trying to bring that in to a broader framework. So that's some of the work that we're going to continue to do, and hopefully set up some systems whereby they can be electronically completed and they can be collated, and the outcomes can be collated and then monitored and measured. And going forward, once we've actually established which is probably the best kind of checklist to use and the additional support action planning process with that, we will develop a policy that will go across the council in relation to the frequency and the monitoring of those things. So that will become a meaningful document rather than a specific document. Hoping for our small pilot to be completed by the end of this month with some of the feedback, going to do that, and then moving forward in the next 3 months to try and get the universally agreed checklist in place. Again, Carol might want to add some more bits around that as we go through.
Yep, so just to pick up the school side of things, so working with the Centre and Inclusion team. So we actually piloted some work which was back over 2 years ago, but within that we had some checklists that were used to look at the environment that was in place for the children, so how children were supported, physical environment, and how that impacted on the support that was given. And we've built that into our SEND advisory service now, so we looked at what was the impact of that, how did that support, and what was needed to be embedded within our service going forward. So table 1 there just really shows over 3 terms the increase in scores of the items that were selected as should be necessary, put in place to support the children, and then what was first put in place during the baseline, and then 3 terms later, had that increased and had that made an impact on the support for the children. So that's sort of what Table 1 shows there, really. We saw a significant increase. So that was following some support, training, learning walks, direct support with the teachers. And it was really based on active engagement and those environmental things that should have been in place. I think for future plans is probably over to you, Graham.
Yeah, I mean, I think in the checklist I've kind of raised that in terms of where we were hoping to achieve, and that'll go across. The intention is that the checklist will go across the whole. It'll be a consistent, equal, single checklist for all those environments. And the key thing, as I say, beyond the policy development, will be the development of a database in which they can be stored, and then actions, which is the key element. The second recommendation related to training. And again, this is a wider update in terms of that. So the council predominantly provides an e-learning awareness training, autism awareness training, and that's been developed again further this year, and it's been included by our experts. By experience, have been inputted into that training as well. So that's been developed. It's still being used. It's still been out there. As of the end of this month, that is now going to be included in all induction across the council. So that anybody who joins the council as an employee will have that as part of their mandatory induction programme starting from the end of this month to the beginning of next month. So that will increase the number of people who want to take that training. We've had a number of people complete the training as well. It is a very short training, and it's an online e-learning training, and it really is about a very basic awareness. We do have a more developed Understanding Autism course, which is a 2-day course, which again we've had extra training on the last 12 months, and we've added an additional 2-day training for the coming 12 months, and that's been really well attended. It's a popular course in itself, but actually the diversity of people across the council and from partners as well, so across from GPs to reception staff to social workers and educationists, and almost everyone across the board have had some attendance in that training, and obviously had some value. That's a 2-day course. That course is also the course in which they would be tasked with, as a task in between the 2 days, of completing the autism checklist in their work environments, which people do, but they haven't fed those back in other than into the group, something that we'll want to try and change going forward. And also the other key thing about that, which comes into one of the other recommendations later on, is that the autism training course that we present here in Hillingdon is actually accredited by the National Autistic Society as well. So we have got that little bit of accreditation there. I'll just move through the other recommendations. In terms of accessibility around online presence, I think this is an area, and Carol's probably got things to add to here as well, that we've made some improvements with. Some of the improvements we've made are some of the links to some of the existing information, and we've been reviewed all of the social care elements of the web pages. I think this is one of those areas where we've recognised that the front-facing web-based activity of the council is quite broad, really, and how you then really embed that in is sort of challenge, and I think that's some of the work that we'll be looking at going forward. We've made some progress in implementing the changes around some of those links, so that for people looking at adult social care activity, for example, they will get information across the spectrum in relation to autism generally and autistic people's needs, etc. That might also appear in our local office of SEND or in other areas of the council web pages. So we're making some clearer links because they weren't there before, and there's some other work that's going on that will add more information, and I think we all recognise it's a bit of a work in progress in relation to that future development around the web-based activity that focuses particularly around accessibility for autistic people.
I think it's fair to say that it is definitely a work in progress. I think there's still quite a lot of work to be happening there. So that actual process is governed by the Families Information Service. So they've actually employed somebody to work on that permanently, which is great for developing the connector support and the directory and the accessibility of that. And actually the functionality as well, I think, has really been difficult over the years with the functionality. So I think there's a lot of work that's going in there and pulling it all together. But definitely there's still some work to be done.
In relation to the accreditation, which is recommendation 4, in effect that's not occurred predominantly, well, entirely because the National Autistic Society for the whole year have been closed to applications for their accreditation, and they've also been closed to applications for their lower level of sort of accreditation as well, which has got a lower level of requirement. We do have accreditation, as I said, in the training, that's been established for some time, and there are different types of accreditation within education settings, which is in the report. Going forward, we are continuing to keep in contact with the National Autistic Society with a view to trying to make forward that application for accreditation as an eligible council service. What we are doing is beginning to draw together an action plan of the activity that we'll need to demonstrate the evidence, because it's quite to get the accreditation, there is quite a lot of activity that you have to demonstrate, some of which are within these recommendations. In fact, that will give us the evidence that we would need to be able to demonstrate that to achieve the accreditation. It's a fairly complex set of pieces of information that will be required. So we'll continue to do that going forward. Now then, the 5th one was a bit broader in relation to made reference to our social work practitioners. We have developed that further in terms of social work, in terms of the advanced practitioner role that has an autism lead. They're linked into the Autism Partnership Board, which I'll talk about a little bit later on. The key areas. We've also developed, which is by individual choice to be fair, but we've developed a champion within the service as well, in addition to that post, and that's the social worker who leads on our training, has been trained. She leads on the training and has a whole range of different skills and abilities that she then shares with other colleagues across social care. So I think that's been quite a helpful thing. The reasonable adjustments guidance is something that we are looking at as well, so that is in place. I think there's a really clear view, and I'm speaking for a third party here because it's not obviously within my gift, but the reasonable adjustments guidance is really about the broadness of recognising people as individuals. So there is we are going to look at changing it. It's due for review anyway, so that is going to be something that's going to be looked at in the next few months. And we'll actually, I think what is missing is naming autism as part of that document, because it's not specifically mentioned. The key issue within that is about the individuality and about treating everybody as an individual, and particularly when it comes to autistic people, because their needs are very diverse. It's about being able to understand that. I think it creates challenges, because if you don't know that individual, it's even more difficult to know how to deal with that. So it's something that is going to be looked at going forward. And as I say, we've had the continuing sort of broader improvements, which I think have really embedded into the Autism Partnership Board, which again I'll talk about in a little minute or two. The National Autism Strategy hasn't all come out, so I think it probably covers that within there. We are considering looking at an all-age autism strategy across the authority, which is something that's now been decided upon, and within that as well there's a whole range of streams of activity that are working with autistic people, and I've got issues around autism generally, and we're trying to pull those together into a single action plan so that we'll actually have a more cohesive approach, partly because we won't then be sort of repeating elements of planning that we're trying to achieve, but also have that wider joined up and linked in approach to that. And then going forward, the procedures is just as I just mentioned, that we're going to look more specifically at the guidance around reasonable adjustment, which is the overarching guidance and policy that covers all of the elements. How we really implement that on the individual basis, I think, remains a challenge. Adding autistic people or autism into each and every policy, apart from what would be quite difficult to achieve. I think there's also a strong view that would be quite tokenistic, and it would be a little bit not meaningful to the individuals who that might be the case for. So we just need to see how we can transpose that, treating everybody as an individual and meeting everyone's individual needs, alongside recognising that the needs of autistic people aren't marginalised or missed is an ongoing challenge, really. And I think that's a general challenge in relation to how you have policy and procedure and guidance and how that works in practice on the front, on the front door, really. And then just some general things about the partnership relationships. I think they've continued. I've only been in Hillingdon for a few months, but certainly in the short time I've been here, the development of the Autism Partnership Board has really progressed hugely. The key development around the expert reference group, jointly with our two key voluntary agencies in the borough, has been really, really valuable, and it's becoming an increasingly meaningful process in relation to their engagement and participation in the meetings. So we as a senior management group will meet with our expert reference group prior to the board meetings. They then contribute to the board meetings, and then we have a debrief afterwards. All of our developing policies, processes, and I gave an example earlier of the development around the learning training. We are engaging with the expert reference groups for their feedback and input. I think we're moving much more towards a co-production kind of methodology in working with people who define themselves as autistic. Just as a simple comment about some of the terminology. So the terminology of autistic people is terminology that has been identified as a preference by our expert reference group, and the board's changed its terms of reference and various other bits and pieces of documentation to reflect that, and it's a terminology that the council have adopted based on the views of those individuals. I think probably most of the other bits are within the report, and I can't remember anything you want to just add.
Yeah, I'll just jump in on number 8 there, really, because it's about partnerships and relationships with all of the people across the local authority that are supporting children or people, young people, adults with autism. So just from a children's perspective, I think you're probably aware that we've set up a governance structure, and within that governance structure there's 5 priority groups, and within that 5 priority groups there's representatives from across all of the different local areas, including health, education, social care, and third sector as well. So they're all part of that, and as well as supporting autism, we're supporting across the board, and that comes under that priority group as well, and that's then Strategic Partnership Board.
Thank you very much indeed. Let me say, just before we take questions, let me just say that this was a review carried out at the height of the pandemic, in not terribly auspicious circumstances, but those who were involved throughout, and I think my 3 colleagues on this slide were, I think would surely look at this and think, actually, do you know what, you've picked up these recommendations, you've approached them in a thoughtful, measured, considered way, and actually really built upon them in a way that's really adding value, and it's good for us to know that, although I can't claim too much credit because I came in at the end of it. But let me just say that for now. We'll open up for questions now anyway. So I think Councillor McQuarrie, you had a question?
Yeah, thank you, Chairman. Just looking at the DSE project that was implemented in the 28 schools, it would be interesting to know a bit more detail about that in terms of kind of where were the schools, how were the schools decided on, just, a bit more detail would be helpful, please.
Yeah, so that was, there was criteria. The criteria was that certain children were making progress. I can't remember the levels of progress, but because it's going back 2 years ago and I wasn't leading on it at that point. But there was definitely criteria, and it was through a funding bid with the Department for Education. So we had to apply for that through the Strategic Partnership Board as well. And the schools, some were selected through the data, but some were also approached and offered if they wanted to be part of that. And it was also, there was a certain percentage that we were allowed to have that were outside of the criteria, so they were chosen specifically. And the project ran over 2 years, and again it was through some of the pandemic. I think that was very difficult, sort of keeping that project going. And it was looking at how can we support children with social, emotional, mental health difficulties, and social and communication difficulties as well, and within a classroom, and make that classroom more suitable and inclusive to meet the needs of those children. And it was really relating to active engagement. So are those children actively engaging in what they're doing within the classroom, rather than just participating or complying? Are they actively engaging with the work that they're doing, and how that's facilitated? And I think we did it at a whole classroom level, we did it at a whole school level, but also at an individual level. So using case studies to look at the impact on the children and the small steps of progress that they're making. And that is what we've really sort of embedded into the service that we provide now, is enabling some of those children to demonstrate progress that they can make, because there's a lot of working towards and it's not always suitable for all of the children. So, and it's also fitting in, so what we're currently working on is how it fits into the engagement model, which is been brought in to replace those P levels, so the P scales, and how we can merge those two things together.
Thank you. Councillor Prince.
Thank you. It's great to see that the change in terminology has happened when the report went to Cabinet and then Executive Scrutiny last year. I remember raising this, so it's great to see that experts by experience have also said that it's autistic people, not people with autism, although still in the report it has people with autism throughout, but I appreciate it's just a report. My question is, and I realise this isn't the basis of the report, but when we talk about inpatient care, the microphone's squeaking.
Sorry.
Oh, okay. Oh, I thought it was me. All right. I appreciate it's not the basis of the report, but when we talk about inpatient care, do we have a number of how many residents in Hillingdon that have autistic residents, even though I've done it now, are in inpatient settings, in hospital settings?
We do have that number, yes, because we would have the list through our Transforming Care Register for all ages, as well as young people, as well as adults. And within my service area, we would have contact with the hospitals. How many there are today, I can't give you the figure, but yeah, we would have those figures. We'll be able to find those figures.
Okay, Councillor Sweeting.
Thank you very much. I think we all must recognise that this is a very, very important major review that's come to us and come through us, and that you are well in the way of starting all of those 8 recommendations, some more than others, I would think. All I would ask is, when the next committee looks at this, and maybe in a year's time, that we have some time scales for it, because some I think are going to take longer to enact, and others, the checklist, for example, that would be good to get that out and rolling over, so it's in our libraries and etc. etc. So could the next report really have some time scales, and also some performance, really? How are we doing? What are our people with autism, autistic people saying about our service? How are they finding it? Is it easier to get the information they require? And so I think we need to have the voice coming as well, please.
I think in terms of timescales, yes, that's something we can definitely look towards, and I would hope that we'll see. I mean, I think some of these things, they've been a while getting off because of the pandemic, because of personnel changes as well. But I think we are moving forward at some degree of pace now. I think some elements of the recommendations will be ongoing, almost, the accessibility of the web pages, for example. We'll never get that right because it needs to continue to be updated and changed. But there are other elements that could do that. Performance across some of the key areas, I think we will need to look at how we can gather that evidence. There'll be certain areas where it will be easier to achieve. Feedback, we are getting more feedback, although I think we have to recognise the expert reference group is a small group of people who do have associations with the wider organisations around, and we just need to make sure that we're being inclusive, I think, in terms of the feedback of those people that get involved. I guess in relation to some of the other issues that have been raised, we do monitor autistic people in terms of their access to services, and those autistic people who have learning disabilities and don't have learning disabilities, those autistic people that have mental health, don't have mental health. So we have some broader data, but in terms of feedback, it's a greater challenge, I think, to achieve that, but we can certainly continue to look at how we can get that. the Autism Partnership Board is an increasingly valuable meeting that does give us some opportunities for some broader feedback across partners and across services.
It's just how are other boroughs dealing with this issue? I mean, are we, a starter, or are other boroughs further along than us, or can we learn from others?
I think learning from others is definitely something we can do. I'm not absolutely clear myself on what other London boroughs are doing. Certainly in the organisation I left a few months ago, we'd progressed in different ways around this agenda. Not that we'd achieved everything. I think for Hillingdon, I think the agreement around the all-age autism strategy development is going to be a really key thing. We do have our Autism Partnership Board, which is adult-based, and Carol's obviously talked about the forums that are children's-based. Whether that's something that needs to be looked at ongoing in the future, it's a way of being more inclusive. They are broadly partnership-led, so we have lots of people from different agencies and organisations there. So I think there's some real positives about how we move forward, but I do feel we probably still are at a fairly early stage in really embedding autistic people and autistic people's needs across the borough in every area that we work within. Positively, just as a very simple sideline, is that we did our work around the checklist with the front door, with social care front door, and with our housing benefit office recently. And the feedback from there was quite positive. And actually, one of the service managers from libraries and museums contacted me, and they're now going to start implementing that. So that's actually quite a proactive link in before we've had to go out there and find those people. They've come forward to us to say they'd like to be part of completing their checklist and having more training, etc. So,
thank you very much. Mr. Little.
I get the impression that schools are being conscious more of autistic pupils and their needs. But does that translate into a more widespread training for the teachers, so that it's not just something that the special needs person or team at the school do, but that all teachers are conscious of what they need to do to accommodate the pupils with these needs?
I think yes, definitely. And something that the SEND Advisory Service are offering is an inclusion commitment. So an inclusion commitment is for all schools, all settings, all early year settings that can sign up to participate and to undergo a whole year of development. So there would be 3 different pathways, one of them being for autism. And what that would entail is really looking at the provision that's in place already, surveying the teachers, TAs, reception staff, everybody from the top downwards, and looking at what their knowledge is already, where do they need development, so where do they need training, and then providing probably about 4 or 5 training sessions across the year, that's also backed up with learning walks to see how that's implemented and actually applied within the setting. So yeah, and that's looking at that wouldn't just be the people that's working with the children with autism. So it's about everybody that's within that school should be trained and have at least some awareness, if not some sort of really in-depth knowledge around autism. So that is definitely on offer. But also we offer targeted training, which is available for all schools to sign up in various different forms. And we will go into the school and do training with the whole setting as well.
Could I just ask, could you give some sort of indication of the take-up so far, or is this something completely new that's just happening?
So it is completely new to a degree, but we've already had really good uptake on this so far. So with regard to the secondary reviews, which is the precursor to the training and the inclusion commitment, I think we've had about 30 primary schools that have signed up, and I believe about 20 PVIs, which is the private nurseries that have signed up too, and so far 1 secondary school. Some of those have taken place and some of those are planned for the future, but they've all sort of signed up to have that. and I would say its capacity is part of the difficulty that we have in terms of delivering a whole year's worth of provision. So the way that we've looked at it is looking at the cohorts of within the school where there is a high prevalence of autism, there's a high prevalence of SEND support, or children with EHCPs. So we've looked at that cohort first and offered it to those schools. Some have taken it up, some haven't, but it's really, some schools recognise their own need as well, and their own training need and development need, and then they've referred themselves into us as well. So we're actually more or less fully booked in terms of the capacity that we can provide with regard to the training.
Thank you. Brings me on to a question of my own, actually. I suppose it's linked to the schools, and it's this old chestnut of there are those that do it, and those that do it we don't have to worry about quite so much. There are others that don't. We can only do so much to compel schools to do anything, to be honest. So I'm wondering whether there's anything in the national strategy that we're hearing about here, or indeed any emerging Ofsted requirements that are helping to encourage schools to get on board with it. That's right, sorry, and I do have a separate question, and this is around ADHD and whether there's any provision for that within the autism strategy as is coming forward. Thank you.
So in terms of the ADHD, there isn't, I haven't picked anything out of the National Autism Strategy so far, but that's not to say that we do support children with ADHD as well within our service, particularly, I don't know, in terms of adult services. So that, we do training, we do one-to-one support as well within the settings as well. Can you remind me of your first part of the question?
Anything in the strategy or within the Ofsted framework, as it's emerging, that will help schools along the way to embrace this, perhaps those that are less willing to, or really not doing quite what we'd like to see them do.
Yeah, I think that...
Sorry, my mic was off. That was awful. Do you think? Shall I repeat that? Do you think, Anisha? I think it was captured first time around, that question, wasn't it? So I shan't. Please go ahead, Carol.
I think in terms of the strategy, I think there's lots of funding that's being promised to schools, and how that translates and how that will actually embed. Some of that has already happened, but that's done through the education improvement team. So they're the ones that actually receive the funding in and disseminate that. So I know there's been some work around mental health, and that supports children with autism as well. And also in terms of if we're thinking about how we can reach those, I love the way that the lady said it actually. It's not the hard to reach, it's the hardly reached, I think is a really key term. I think that's a really lovely term, which I'm going to be taking forward for sure. But it is definitely, it's those hardly reached schools and those schools which maybe don't engage so much, I think is a difficulty. But we're working with wider partners across our teams and across the local authority to actually reach some of those schools and to engage them. And it's partnership work, I think, that's really needed.
Very much indeed for that. I'm looking around the room and there are no more indications. So with that, Graham and Carol, can I thank you for your input there. And it's really possible. Handsome contribution to the Mayor's charity coming, obviously. It seems like we're making some really significant progress on this. I'm delighted to see it, and clearly the National Autism Strategy will require a further report, and hopefully this has laid some of the groundwork for where we need to go. So I'm really pleased by that. So thank you very much for your work in that area. Okay, is the recommendation agreed? Thank you. Right. I think we're back to Alex now for semi-independent living for young people. I think perhaps a bit of context before you start, Alex. If people are wondering why it is this report's come to this committee rather than corporate parenting, I should just explain that its background was around the closure of Olympic House 2 years ago. Councillor Gardner and I at the time had quite a bit of engagement over that. This provided accommodation for this particular client group. There was concern over the decanting arrangements where these young people would live and the suitability of that. And I think it was decided at the time that the parent committee should actually take this initial report and thereafter it should go to corporate parenting. That's why it's here this evening. So with that, over to you, Alex, please. Thank you.
Thank you, Chair. So that being the context of now almost 2 years on from the closure of Olympic House, I just want to kind of set a bit of context from a kind of, the cohort that we're talking about perspective. So in terms of the semi-independent, when we talk about semi-independent provision, we are talking about provisions it's available for children who are looked after, and they are between the ages of 16 and 18. And we do have some children over the age of 18, I'll mention that a bit later on, who are still in some of the semi-independent provisions. It's a very small number of them. But also, up until last year, it was always a recommendation that children under the age of 16 should not be living in semi-independent, should not be placed by local authority in semi-independent provisions. And from September last year, it became law, and it becomes basically illegal to place children, for children under the age of 16 to be in a semi-independent provision. And I really wanted to kind of, just reassure everyone that in Hillingdon we haven't been placing children under 16 in semi-independent, and all our children who are in semi-independent provisions are 16 or older. Equally, the change in legislation from September of last year have also made it quite clear that even if the child is over the age of 16, if their needs are of care, not of support, they should not be living in a semi-independent provision. They should be in either residential provision or in a foster placement or other forms of provisions which are meeting their needs. So just to kind of quickly address that point, because I think it's quite an important one, I think we need to be aware of that for all our children. We use for all the children who are in semi-independent provisions and all those who are now entering semi-independent provisions, we use a Ofsted issue tool to assess each child individually and the needs of them in that provision to determine if they have a care need or a support need, just to make sure that all the children who are in these provisions do not have a care need. And so that has been done. So we are quite reassured that all the children who are supported semi-independent have support needs. Hope that is kind of clear, because it's quite an important distinction. Just to put some data, as you will see throughout the report, in the context, the data is based on the data as it was available at the end of February, and that was the time when the report was being written. So at that time, the Hillingdon Council was corporate parenting parent for 463 children, and out of those, 159 under 18s were living in semi-independent accommodation. Now, at the same time, there were 39 children over the age of 18 who were in semi-independence, and the reason for that being that they were not yet ready for independence. They were not yet ready to move into their own tenancy, so they will continue onto their pathway for independence. Now, I will touch a bit on that when I'm talking about the long-term impact of COVID. The second table on page 75 provides a breakdown of the ages of children who are supported through semi-independent, and you will see in there that I think it's about 120 are of age of 17, which is reassuring, and that's what we want to see, because that demonstrates that semi-independent placements are part of the pathway plans and support them into developing towards independent living. So the majority of our provisions that we're using are small provisions, so are kind of 5 to 7 beds, which we consider both meets better the needs of the children, but also it makes the matching of the residents in those houses makes it much easier and much better for the children to make sure that the right group of young people are residing together. And also, whilst they are receiving support in the semi-independent, all of these young people have an allocated social worker and or a personal advisor. They also have an independent reviewing officer up to the age of 18, and they also have and continue to have access to independent advocacy service, which we commission independently from Quorum. So all that is in place for them to raise any issues they might have, to raise any concerns, and to make sure that they receive the support that's required. In terms of how we're sourcing our semis, this has been quite a significant change in the last 12 months. We are sourcing the majority of our placement through a dynamic purchasing system that has been developed by the West London Alliance, of whom we are part of. So Hillingdon alongside other boroughs in west of London, and then in wider London through the Commissioning Alliance. We are subscribers to the dynamic purchasing systems, and what that actually means is that all the semi-independent provisions we use have actually been checked. They've been visited. They've been checked by people to make sure they're safe, to make sure they meet the criteria that are required, and we are not using provisions which are unknown to anyone. Now, in the small case, in a minority of cases where we still have to source provision ourselves outside of dynamic purchasing system, those are very few. We are using the same criteria as the West London Alliance are using to make sure that the same criteria applies. And also, we talk to them about our findings, and we talk to them about what the state of that provision is. The other thing that we've done in the last couple of years, we, in addition to using the West London Alliance provisions, we also retain and enhance our quality assurance and monitoring functions in Hillingdon by combining the brokerage service across children and adults and building within the service quality assurance function, which means that we do have people, some of our officers, actually going out and spot checking placements and doing some follow-up checks. So we're not solely relying on the WLA checks. We are also doing our own checks, and then equally we feed back to WLA, we feed back to the dynamic purchasing system, and so on and so forth. And and in the financial we're now in, the WLA are looking at implementing the quality assurance portal, which it's an enhanced check of all the provisions. So it kind of builds on the success of the system we have now in place, and brings even more stringent checks to make sure that they will include any flags on any sort of potential risk, potential ongoing investigations like LADOS investigation, and also crucially, I think it's quite important from my point of view, will include the feedback of the children who are receiving the services from the semi-independent, because that's ultimately that's what matters the most in some cases. And so I just mentioned COVID impact just very briefly to make a couple of references to that. So one of the things, as I said, we moved towards smaller provisions because we felt that less children living together meet their needs better, and so on and so forth. But what did then happen with the long periods of lockdowns, long periods of self-isolation, and so on and so forth? We had a lot of children who didn't really have maybe sometimes family in this country, or quite access to a lot of family and friends. They became very isolated in some of the venues. So during that, what we've done, we enhanced the support that we commission and the support we provide to our own staff to make sure that it's available to all of them, and that actually, well, some of them continue to this day in terms of that enhancement of support. But also, what the rules of during COVID led to were some of the young people moving into semi-independent later than they would have otherwise, because although maybe they were ready to move at the age of 16, due to the inability to kind of move between households and so on and so forth, they stayed with previous placements for longer. But also, some of the children who were already in semi-independent had not developed towards their independence as they would have done otherwise if they had access to everything that's available in the communities. So hence why we are still seeing a number of young people over the age of 18 still being supported semi-independent, still working through their pathway plans towards independence. So lastly, just to mention that as a few other next steps that we're looking at doing, We also want our children and young people, which some of you will know from the corporate parenting panel, for instance, and other forums, we want to engage them as young inspectors to actually go out there to see some of the semi-independent provisions and to do the type of checks and inspection they do for our residential provisions, because we feel that it's very helpful, it's very child-centered, and it provides that sort of different perspective on what good looks like. So that's another thing that we wanted to do, and I'm sure that's going to be monitored to the corporate parenting panel, because I'm sure that will be a great success. Thank you.
Alex, thank you, as ever. Right, I think I've got a question from Councillor McConnell.
Thank you, Chairman. I think Alex already covered it, because it was just about focusing. Obviously, our role as corporate parents is very important, and we want to ensure that we capture the voices of the young people. But yeah, I think you mentioned it already, so thank you for that.
Councillor Prince.
Thank you. Unaccompanied asylum-seeking children, my favourite subject. They arrive in the UK, their age is disputed. Are they put in this type of accommodation?
Yes, if they have the required skills to look after themselves, the independent skills, then yes, they are. And they are supported, and they are allocated a social worker, they are allocated a PA, they are allocated independent. So everything that applies for any looked after child applies for them as well. And with the addition of specialized school provisions, like for instance ESOL courses, the English as a second language courses, and they will have access to translations. They will also have access equally to independent advocates. And to be honest, looking at the numbers of independent advocacy being used, unaccompanied asylum signature are using probably the most, because they want that sort of independent view about their asylum status, about their housing entitlement, the benefits. So all that, it's actually really good to see that in terms of advocacy. I know it's not about that, but I think it's a really good indicator that probably about 60% of the young people who actually access advocacy, they refer to it themselves. So they don't need to be referred by someone. They know their rights and they access those rights, and that is really good to see, especially for the unaccompanied asylum-seeking children.
Yes, thank you. Is there any effort to try and put them in, say, a shared house with people who also come from the same background as them? So do you tend to group unaccompanied asylum-seeking children by country, or just by the fact that they are USAC? Thanks.
When I mentioned before the shift towards smaller provisions, which will allow us a better matching, that's part of what I was referring to. Because when we're talking about matching young people, we're looking at their culture. Sometimes the same country might not be a good way of doing it, because obviously there's in-country conflicts and so on and so forth. But we are looking at a variety of factors to identify which young people are kind of better suited together. And sometimes they will arrive in a country together. They will know each other from the country of origin, from the transition into the UK. So we will striving to maintain those relationships.
No one else is indicating. Were you indicating? Oh, Councillor Sweeting, please.
I have a couple of questions. What about young people who are complaining about their accommodation? How are those complaints dealt with? And secondly, has the quality assurance regime actually reduced the number of placement moves, as the report, page 72 of the report, suggests that was the way forward on that?
In terms of the placement moves due to the quality of the provision are reduced. I think I don't have the number to give to say exactly that there's how many. In terms of the actual number of placement moves, what we will see at the moment, because we had an influx of unaccompanied asylum-seeking children in December, so we had I think it was about 72 in 1 month, which is very high for anyone. And we've seen quite a lot of making sure that the children are matched. The children are matching their placement, and there was some movement around those particular placements. But in terms of complaints about housing conditions and about accommodation conditions, or any other complaints for that matter, we encourage young people to speak to their social worker, to speak to their PAs. But that's one of the reasons why we have an independent reviewing officer who will be chairing the reviews, will be overseeing their looked after plans, their pathway plans, and will make sure that their voices are heard. That's one of the reasons why they have access to the advocacy service if they want to speak to someone totally outside the local authority and to raise questions or to raise complaints. And we do get complaints from our independent advocate. They're coming straight back to us, and then we respond to those. And we also have our normal complaints process. But the focus is, and I think is rightly so, the focus is on communication, is on talking to young people and making sure they actually understand, in some cases, that is not for anyone's lack of trying or willingness to resolve an issue. Sometimes issues are very difficult to resolve and they take time, and sometimes that's difficult to explain.
My question on this was really around the involvement of P3, which is referenced in the report. And I suppose with this particular client group, as corporate parents, we think to ourselves, well, how is that support working in a way to make sure that people who are at risk of abuse, trafficking and all kinds of other nasty things are actually in our radar, and we're doing everything we can to manage and mitigate that risk? How does that sort of process work, please?
So any child who's a looked after child, they will have their looked after plan, which is reviewed by independent reviewing officer, allocated workers, and all those sort of services that I already mentioned. And that is no difference regardless of where they're placed, regardless of which provision is in place, regarding what type of accommodation, being that foster placement, residential, semi-independent, and sometimes for care leavers, independent accommodation, because some of them will receive support in independent accommodation as well going forward. In terms of P3, we are well engaged with them. They're good providers. They understand our priorities. They understand our processes. And if there's any concern, they know to come to us, and the young people will know to speak to the allocated workers as well. And I think in terms of not just the P3, but any provider for young people, children and young people, specifically if we're talking about semi-independent, we are very clear that they have the right process in place as part of the checks, as part of accreditation. We're making sure they have the right safeguarding procedures in place. They have the right ways in which they can raise any issues, spot any issues in the home, and make sure that they're talking to us.
Alex, thank you for that. I'm looking around the room and I can see no one else indicating. So with Mr. Little, no, fine. So with that, I will draw this to a conclusion. Thank you very much.
Thank you.
For that update. It's reassuring to see, Alex, that we do have some sound processes around this. Another very challenging area of service, vulnerable young people. So important we get it right. And I think we can take some comfort from what you shared with us this evening. So I will move the recommendation. And I think perhaps can we add that this paper comes to corporate parenting in future if we're happy with that, if everyone has agreement. Thank you very much.
Thank you.
That's agreed. We'll move on. Alex, thanks for joining us. Thank you. Which I am going to ask Councillor McFarlane to move for us. Alex, don't worry. No questions this time, or maybe I don't know.
Okay, thank you, Chairman. So agenda item 9 is just the minutes of the corporate parenting panel. Obviously, we just need to approve the minutes, but I just wanted to highlight one thing. I mean, the meeting was a while back now, but something that is important to just for members to be aware of is that suggested improvements and further action was about increasing work experience days, especially for our young people, and maybe some mentoring from our councillors. So I think going forward, certainly after the election and all the rest of it, and whoever the new committee are, we need to really focus on that. I think that is really, really important. Certainly the chairman of corporate parenting panel, Councillor Dennis, he did provide some work experience day, which I think was well received. So I think that we should all kind of follow in his footsteps and try to ensure that we implement something in the future.
You want to comment, Alex, on that, please?
Yeah, if I may, because I'm part of the corporate parenting panel as well, and just to kind of picking up from that point, which I think, our thanks to Councillor Dennis for that data. That was great and indeed well received. One thing that we're looking at doing with our colleagues in social care and the virtual school is to put together almost like an aspirations list for all our children who are looked after, just so that we know what they aspire to do going forward, and then to bring that to yourselves and your colleagues as well, to say, well, this is what our top 10 aspirations of our children are. So what can we as corporate parents do to support some of that? So that will come to the corporate parents panel, and I'm sure will make its way here after that.
That sounds great. Okay, is that agreed? Councillor Philip.
It's just a point of clarification, actually. Looking at point 49 on page 81, it mentions the review of youth services by HMI. Is that available? Is that report available?
I don't know the answer to that. I've been told these are for discussion. For noting rather than discussing. Can we find out? Do we know just since the question has been asked?
Yeah, by the time of this this meeting, so this forum, that information will be available. At the moment, it's not publicly available just yet.
Okay, thank you. Okay, recommendation agreed on that one. Thank you very much indeed. So we move on rapidly to the Cabinet Forward Plan. I move the recommendation. Any comments or questions, or can we agree that? Agreed. Thank you very much. And finally, the work programme, which, as you will see, is blank after May, and the reason for that is it gets populated and agreed by the June committee, whoever's involved in that. So that's the reason for that. Any comments or questions on that one?
Thank you. Just commenting generally on the future work plan. When can we expect the information on the youth services report to come back? Is it that we're going to be waiting until the next cycle of meetings, which may be in 9 months' time? Because we are disappointed that we didn't get the information that we asked for as a committee, and I do think it's in the remit of a councillor to receive information that we deem necessary to carry out our scrutiny function. Thank you.
Okay, well, look, all members of the committee will have seen the response that came from Anisha, the officer team, to the effect that the youth service has been impacted to the extent over the past couple of years with a pandemic that it's really been turned upside down, really, in terms of usage and what have you, and therefore we haven't really got any meaningful data to share. The whole thing is being entirely looked at again and recommissioned, and it's more sensible to have a report with something meaningful to say, quite honestly. You may not agree with that, and I suspect you won't. I can tell you can't. Councillor Scrutiny, I will bring you on this, but this is what Dan Kennedy said, and I'm inclined to agree. Reluctantly, because it would be nice to have something, but I don't think that's an unreasonable position to take. Councillor Sweeting.
I don't think we wanted a War and Peace report. We didn't want anything in great detail, but just something basic, such as which of our youth centres are open, for how many hours, and what courses are happening for the summer term and during the summer. Just something as simple as that would have been useful.
Noted, and I'm afraid that we're going to have to leave it. I think we're going to have to agree to differ, I'm afraid. I'm sorry to end on a discordant note, but I mean, that it is what it is. I think Dan's response was reasonable in the circumstances, but there we are. With that, can we agree the recommendation on this item? So that brings our meeting to a conclusion. Obviously, this is the last meeting for a certain event on the 5th of May. I would like to thank all the officers who have supported us throughout our deliberations this year. We had some great, really meaty discussions. I think we've done a great job as a committee. I've thoroughly enjoyed working with you all on both sides, and I think we've had some good discussions. I'd like to thank Anisha for her support to the committee. She's done a great job in that. And whatever happens, however the dust settles on the 5th of May, I wish you all well. We'll see what we're doing after that, I guess. I don't have a crystal ball. And finally, thank you to our watching public for joining us this evening, and to Lewis, if I can drop his name in as well. We'll wait for a moment for Anisha to cut the link. Thank you.